My name is Elaine Muchmore, and I'm here today to talk to you about wellness. Wellness, according to the WHO, is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. You should know that I did not choose this topic, but was thrilled to be able to talk with you about it because I think this may be the most significant thing to master during your fellowship. So many of my peers remember that I trained at a time when there were no duty hours limitations, did not recognize warning signs, and ended up making regrettable decisions. And I was so busy with my own work and life that I didn't even appreciate their distress. It was only in retrospect that I began to understand. Since I finished training, there have been many research studies and opinion papers about how to optimize wellness during training. It was originally thought to be just about sleep deprivation, and certainly I would be one to say that that needed to be corrected. The first national change was in 2003, when the ACGME, as the accrediting body for all training programs, set limits for weekly assigned duty hours and shift lengths. Later came limits or caps on the numbers of patients assigned to each team. These measures definitely helped with duty hours, but as you all know, there has been a major change since 2003. The intensity and complexity of patients has increased. The term burnout has been used to describe a common reaction to the current working environment. To cut to the chase, burnout has been reported by more than half of both trainees and their supervisors then and now. This means that a substantial number of you have been or are already affected. Strategies to mitigate stress and to increase wellness have been priorities for all layers of the healthcare system, since optimization of quality healthcare is intimately tied to wellness of the workforce. And now it is clear that there are as many techniques to enhance wellness as there are physicians, because each of us has different ways of dealing with personal and group stress, and each of us has different needs and comfort zones. So that's it. We all just need to determine what makes us feel good and the problem disappears. Unfortunately, that is too simplistic, just as duty hours was too simplistic. When people are burned out, they start to withdraw from social interactions. They feel embarrassed that they are having trouble and put barriers between themselves and the people they care about and with whom they work. And a vicious downward cycle can happen. So what can be done? The most important thing to realize is that burnout is a clear and present danger. As I said, if we are completely honest, it already impacts a substantial number in this very room. Each of us will have professional ups and downs that can be mitigated, but we need to work on it. So how can this be approached? I think the same skills we use to initiate difficult conversations with our patients can be applied to our work groups. If you notice changes in attitudes that seem concerning, I think the best approach is to pursue whether there is a significant underlying stress that is impacting that team member. It is fortunate that hematology-oncology training is team-based, because through the close working relationship with fellows and faculty, we are in a position to notice changes in affect of members of those teams. Teams that function well share details about their personal lives, and this knowledge can provide a unique window for intervention. I anticipate that you will join me in embracing the strategy of initiating difficult conversations after you do this for the first time. I encourage you to try. I feel passionately that this team approach is necessary, because I do not think one person can enjoy wellness if coworkers are stressed and burned out. So the most important steps are to be sensitive to ourselves and to others, and to make sure to speak out if something appears amiss. We can improve wellness of ourselves and our teams, but only if we choose to do it together. Thanks.